Hello everyone, my name is Junior Fumojena and my topic is pulmonary system, and I welcome you to my presentation on pneumonia. So what is pneumonia? Pneumonia is a common respiratory infection affecting millions worldwide. Today I'm going to look into causes, symptoms, treatment options, and preventive measures of pneumonia. So I have a case study here. John is a 58-year-old man, presents to the emergency department complaining of a persistent cough, fever, and difficult breathing for the first 5 days. He reports that the cough is productive with yellowish green sputum and has been experiencing chest pain that worsens with deep breaths or coughing. John also feels increasingly fatigued and has noticed a decrease in his appetite. John mentions that he has a history of smoking but quit 10 years ago. He denies any recent travel or sick contacts. On examination, John appears visibly distressed with rapid and shallow breathing. His temperature is 101.5 degrees Fahrenheit or 38.6 degrees Celsius. His heart rate is 110 beats per minute. His respiratory rate is 28 beats per minute, and his oxygen saturation is 90% on room air. Auscultation reveals crackles in the lower bilateral lobes. His symptoms and clinical findings indicate pneumonia, so further evaluation and treatment are initiated. John has a past medical history of COPD, type 2 diabetes, and COVID-19 that he just had 2 months ago. So what determines pneumonia? Pneumonia has been determined based on John's symptoms and clinical findings, and additional testing and treatment have been started. The chief complaint of pneumonia typically includes respiratory symptoms such as cough with phlegm or pus, fever, sweating and chills, shortness of breath, chest pain, fatigue and muscle pain, nausea and vomiting or diarrhea. Patients may exhibit confusion in severe cases, especially in old adults. Children may present with similar symptoms but may also show signs of respiratory distress such as rapid retractions, visible pulling of the chest wall with each breath, grunting, nasal flaring, and cyanosis. So what causes pneumonia? Pneumonia is an infection of the lungs caused by bacteria, viruses, fungi, or other microorganisms. In adults, the infection typically affects the alveoli, causing inflammation and fluid accumulation. Pneumonia can be categorized as community-acquired CAP, health-associated HCAP, including hospital-acquired HAP or ventilator-associated VAP. CAP is the most reasons for hospitalization. In children, pneumonia often affects the smaller airways and interstitium of the lungs. Viral pneumonia is more common in children and can result from respiratory syncytial virus RSV or influenza virus. Bacterial pneumonia in children can result from Streptococcus pneumoniae or Haemophilus influenza. Bacterial pneumonia is caused by Streptococcus pneumoniae. Viral pneumonia is caused by influenza viruses, respiratory syncytial virus, and others can lead to pneumonia. Fungal pneumonia, less common, but can occur in the people with weakened immune system. Below are just images of a normal lung with bacterial pneumonia and lung with viral pneumonia. It was just interesting when I saw these images. Usually the radiologist will read the x-rays for us. Common labs and diagnostic studies. Diagnosis of pneumonia often involves with clinical assessment, chest x-ray, and laboratory tests. So we have a physical assessment and medical history, chest x-ray or CT scan, blood tests to identify the cause, whether it's bacterial, viral, or fungal, sputum culture, blood cultures, and ABGs. So usually we do CBC to make sure that there is no elevated white blood cells, mainly neutrophils because they cause infection. Blood cultures, we just want to identify the causative organism in severe cases. ABGs, we just want to assess the oxygenation status and acid-base balance, especially in severe cases. Chest x-ray, we have to visualize infiltrates or consolidation in the lungs. Sputum culture to identify the causative organism and determine antibiotic sensitivity. So these are important tests that we run when someone has pneumonia. Management and treatment pharmacologically. Empiric antibiotic therapy is often initiated based on the likely causative organism and severity of illness. So for bacterial pneumonia, we usually give people antibiotics. For viral pneumonia, they are given antiviral medication. And for fungal pneumonia, they are given antiviral drugs. And the other thing that we can do is supportive care, which means people have to rest, have to drink a lot of fluids, they need to be hydrated, and pain relief. So for pain relievers, we usually use antipyretics to reduce fever and discomfort. We can use bronchodilators in case of reactive airway disease or bronchospasm. So anytime someone is sick, we just have to encourage them to drink a lot of fluid. Adequate fluid intake, it helps to prevent dehydration and help loosen secretions. So fluids is the best thing that you can tell your patients to drink. Cultural beliefs and practices may influence treatment preferences and adherence to therapy. Socioeconomic factors such as access to healthcare, living conditions, and nutritional status can impact the risk of pneumonia and the ability to manage it effectively. So if anyone cannot have access to healthcare, they won't be able to be treated. And also it's hard for them to heal without getting treatment. When people don't have enough nutrients, it's hard for them to heal. Living conditions, when someone lives with someone who smokes, they are second-hand smokers, and those are the ones that are mostly affected when you're a second-hand smoker. So there are a lot of things that impact the risk of pneumonia. So how do we prevent pneumonia? Mostly people have to be vaccinated. The vaccinations that are needed for prevention of pneumonia will be pneumococcal and influenza vaccine. Also hand hygiene, regular hand washing is so important. Avoiding smoking and second-hand smoke. Managing chronic conditions. So there's so many ways that we can prevent pneumonia. Prognosis and expected health outcomes. With appropriate treatment, the prognosis of pneumonia is generally good, especially in otherwise healthy individuals. However, severe pneumonia, especially in the elderly with underlying conditions, can lead into complications such as respiratory failure, sepsis, lung abscess, pleural effusion, acute respiratory syndrome, or death. Children with pneumonia generally have a good prognosis, but severe cases can lead to respiratory distress and require hospitalization. Pneumonia requires prompt diagnosis and appropriate management to prevent complications and optimize outcomes. Treatment should be tailored based on the individual's clinical presentation, severity of illness, and any underlying health conditions. Conclusion: pneumonia is a serious respiratory infection with various causes and risk factors. Early diagnosis and prompt treatment are crucial for a good outcome. Prevention through vaccinations and good health habits is a key to reducing the burden of pneumonia worldwide. Overall, with prompt diagnosis and appropriate management, the prognosis of pneumonia is generally good, although severe cases may lead to complications. Therefore, a comprehensive approach to diagnosis and treatment is crucial for optimizing patient outcomes. There are my references. Thank you.